Hi everyone, thank you for joining us. This e-mental health presentation is provided by the Department of Health and Community Services in collaboration with the 4 regional health authorities in Newfoundland and Labrador. I'm Meghan Churchill. I'm the regional e-mental health manager with Eastern Health, and there are 4 e-mental health managers across the province connected to each health authority. Central Health's e-mental health manager is Byron Boyd, Western Health is Tracy Wells Stratton, and Lab Grenfell Health is Victoria Kearney. If you have any questions or anything like that after this presentation, please feel free to reach out to the e-mental health manager in your local RHA area. So technology is a great opportunity to support and enhance mental wellness in an innovative and helpful way. And today's session is an introduction and an overview to e-mental health services in the province. So you might have heard of the Towards Recovery Action Plan. This plan is guiding the transformation of the provincial mental health and addiction system through the implementation of 54 recommendations of the All-Party Committee on Mental Health and Addictions. These recommendations span the full continuum of services and include things such as addressing stigma, reducing wait times, providing better supports for youth and young people, and restructuring community-based and hospital care. Of these 54 recommendations, 7 of them are related to using technology. And some of those examples are stepped care, ICBT, early intervention, and system navigation, just to name a few. And their purpose is to provide enhanced mental health and addiction services, which we're going to focus on today throughout this presentation. So part of this transformation involved the implementation of a step care model. Step care provides rapid access, same-day, flexible access to wellness and mental health resources that include e-mental health apps, online self-help services, and behavioral prescriptions. It is an evidence-based system that provides the least intensive and most effective options, so clients have the greatest likelihood for improvement. Treatment can either be stepped up or stepped down as needed. In 2015, there were various working groups and committees supporting the rollout of stepped care with the oversight of Memorial University, the Mental Health Commission of Canada, the Department of Health and Community Services, the regional health authorities, and the Newfoundland and Labrador Centre for Health Information, as well as people with lived experience with mental health and addictions issues. Given our vast geography and the high number of Newfoundlander and Labradorians who access the internet, which is about 90%, utilizing e-mental health technology makes a lot of sense. 76% of Canadians access the internet using their smartphone. One of the key access points under the step care model is online services. Technology is often effectively used in healthcare to control, detect, screen, treat any kind of illness. And so e-mental health uses the internet and technologies to help people receive support for their mental health and addiction issues when and where they need it most. We've had a 68% reduction on wait times overall in Newfoundland and Labrador for mental health and addiction services. This reduction is as a result of several changes to our mental health system, including stepped care and e-mental health. So the stepped care model currently being worked on in the province identified 3 key access points. These access points are needed to establish consistent options to the public for improved access and system navigation, and they include in-person, online, and telephone. By allowing individuals to choose the access points that best meets their needs and preferences, potential barriers are then reduced. Doorways is our in-person option that provides rapid access to mental health and addictions counseling. Some locations offer walk-in, while others provide same-day or next-day appointments. If more counseling is needed, staff are able to use screening and assessment tools to arrange access to additional services and supports to step up the person's level of care. Doorways right now is available in over 50 communities throughout the province, including some adult correctional facilities and schools. The online option is Bridge the Gap, which is the provincial go-to mental health and addictions website. Individuals are able to look up services in their local area, find information about various mental health and addictions topics, and gain access to free online mental health services. And the telephone option is 811. Individuals can call 811 to speak to a registered nurse to get information about services in their area, mental health topics, as well as receive support. The goal is for individuals to have a common experience no matter which entry point they choose. And we're currently working on having one assessment tool to be used at each point of access. So what is e-mental health? The Mental Health Commission of Canada defines e-mental health as mental health services and information delivered or enhanced through the use of internet and digital technology. We use the Mental Health Commission of Canada's definition as they have been involved in the implementation of e-mental health services not only in Newfoundland and Labrador, but across Canada as well. And if you're looking for additional information, you can certainly go on their website. They have lots of information there about e-mental health and also how it can be implemented in your area. So a wide range of technology is being used to support and improve mental health, and its application to support mental health is constantly expanding for ease of use, convenience, and to provide greater options to people. People likely already use most of the options on your screen every day. There are over 100 mental health apps every day that get created, and there's no regulating body in North America that determines which apps are utilizing best practices. So as a result, we surveyed our health professionals in the field of mental health and addictions across the province to see which apps they're using and recommending in their practices. We then took that list and had the apps reviewed by individuals with lived experience at Channel. And all of the apps then that were determined to be helpful are being posted on Bridge the Gap under the Toolbox tab. And so as new apps come out, we'll review those and post them under Bridge the Gap as well. And this just helps people cut down on the time they have to try out different apps in the App Store and look through all the different apps that might be available to them if they want to look at the ones that people in our province and professionals in our province are using and recommending already. The e-mental health team in the province is also constantly researching new technologies, and right now virtual reality applications are rapidly evolving. VR is used in the treatment of anxiety disorders, so it's used with exposure therapy elsewhere in the world. And there's also examples of it for using mindfulness or guided meditations as well. So that's one that we're keeping an eye on and are continuously looking into and have some interest in. So why do we use technology for mental health and addiction services? E-mental health provides high quality support and services based off of extensive research and best practice. Although it's new to Canada, newish to Newfoundland, it is not new worldwide. Places like New Zealand, Australia, the UK all have well-established e-mental health options. And what's exciting is that we are the first province in Canada to roll out e-mental health services for our whole population in our province. E-mental health isn't designed nor intended to replace in-person services if they are preferred or needed. It just gives people more options and enhances access to services when and where they're needed most. In fact, there's actually more e-mental health choices now than ever, and they allow people to have control over how and when to access information and support. E-mental health also encourages and allows people to get support early in order to help minimize the impact of mental health and addictions issues on a person's life and to reduce harm. This information and support is available to people regardless of where they live in the province, and most of the services are available 24/7. So there's a wide range of e-mental health services that are free of cost and available to every resident in this province. While some services are focused more on either youth or adults, many are appropriate for both. Bridge the Gap acts as a storefront for these services, and it's our go-to website for residents in this province looking for online mental health services and information. The many options include self-directed information and activities, information about crisis intervention and counseling in your community, as well as physician and other community contacts. Most services provide multiple ways to connect and include accessibility options such as the teletypewriter or text telephone. For convenience purposes, the site itself is divided into adult and youth sections, and it's available to anybody on a tablet, computer, or phone at no cost, as I've mentioned. Much of the content is the same on both sides. However, the youth section contains more content related to youth issues, such as bullying, for example, while the adult side will have topics related to adults. Although there's crossover, for example, adults and youth can both experience anxiety and depression, the way the information is presented might differ. So the features on Bridge the Gap include a service directory where people can read about and locate mental health and addiction services that are right for them. A knowledge center on the adult side and an information booth on the youth side, which contains information about topics of interest like stress, depression, suicide, bullying, substance use, and parenting. So if someone is looking for accurate, up-to-date information, they can go there. On the adult side, there's a Get Inspired section. On the youth side, there's a MySpace section, which provides people with opportunities to share with others and to explore their creativity. And then we have links to online programs, which I'm going to outline further in this presentation. And lastly, there's a toolbox, which provides people with resources and self-help activities and just ways to engage. The website and storefront were co-designed with people with lived experience of mental illness and addictions and healthcare providers in the field as well. As of October 2019, there were approximately 40,000 annual unique users on the website. So I'm just going to take a second to show you the website, and you can see where all those tabs are. I'm going to go into the adult side, and the tabs that I just listed off are all across the top here. So in the service directory, it's broken down by health authority. And it's not just health authority programs and services listed. We do have all of the community partners within mental health and addictions listed there as well. So if you're located in the Eastern Health region, you can find all the community partners and Eastern Health services underneath there. Or if you're in Central Health, you can go under and see what's available in that area as well. If you're looking for our Doorways clinic options, you can go into tags and click Doorways Walk-in Counseling. And then it can show up under your health authority, all the Doorways offices that it's available to you. The Knowledge Center is our A to Z list of the different mental health and addictions topics. And this is growing. We are adding to this list, so you might see more topics showing up there in the near future. We then have the Get Inspired section where people can actually post information about their own coping tips as well as their own hope for their future. All the information that gets posted in here does have to be posted anonymously. So as long as there's no identifying information, then the coping tips will be able to go up, as well as the recovery stories and the wall of hope. So if you have a look there, there's some different types of coping strategies that people in our community and province are already using. And just show you the wall of hope. This is where people are able to post their stories about recovery and hope for their own future. So some of them are long and some of them are short, but like I said, as long as there's no self-identifying information, then it can be posted up there. The online program section, so this is where you can access all of our online programs that we have available in the province for free. It's important to note that you do have to go through Bridge the Gap in order to be able to get them for free. Technically, you could Google some of these programs, but they would come up with a cost associated with them. So as long as you're a resident in Newfoundland and Labrador, just make sure you go to Bridge the Gap, the online program section, and then you can click the sign up for free buttons that are next to them. And lastly is the toolbox. So here are some different resources. And like I mentioned, that's where you would find the apps that we have available to you. There's a mood meter that you can go on and rate your mood and get some coping tips that might help you. And then there's also a section here for Have Your Say if you wanted to give us some feedback on Bridge the Gap as well. So I'm going to tell you a little bit about the first program that is available through Bridge the Gap. And that's the breathing room. So the breathing room was developed by an Alberta organization called Canadian Institute for Natural and Integrated Medicine in collaboration with the University of Calgary, Mount Royal University, Alberta Health Services, and with input from over 100 young people. It was clinically tested with youth ages between 13 and 24, and it was found to be significantly lower depression severity amongst those age groups. Adults over 24 have also found it to be helpful, but one of the things you'll notice is the person who guides you through the program will relate more to that particular age group because she shares her story and her journey, and it certainly does relate more to the age group of 13 and 24. However, the skills that are in this program certainly could benefit people who are older than that age. They just might not relate to the guide stories that they're sharing in the program. So the Breathing Room is an online self-management program for people in search of ways to manage stress, anxiety, and depression. Each module can take 2 to 3 hours a week. However, there's no set time frame for you to complete the program. It was originally designed to be taken over 8 weeks, 1 module per week. However, you could take 1 week or 15 weeks. You do what feels best for you and what might work best for you in your schedule, and you can go through the program at your own pace. This program, like I mentioned, is free of cost. There's no referrals to complete it, and the link to join is under the Bridge the Gap online program section. As of December 2019, we had over 2,000 people in our province complete the program. So these are just some of the features that are in the program itself. So the fresh insights are from medical experts who have helped others move forward in their lives. They're giving you some information about various topics. There's an engaging program host who will guide you through the program, and she'll share her personal journey and recovery. There's skill building practices such as guided visualizations, mindfulness, deep breathing, and positive affirmations to help people relax and cope with stressors. Then there's simple offline activities that you can try out as well, such as music, movie and book suggestions, true stories written by young people who've dealt with tough situations, as well as jokes to lighten a person's mood. So I'm just going to show you, if you wanted to watch an introductory video, you can see the program host who guides you through the program when you click sign up for free to the online program section. There is a little video that you can watch. It's only a couple minutes, and it'll give you a sense of what to expect from the program. So that's just right here. And then there's some frequently asked questions. If you wanted to look at any of these, you certainly can. So the next program that we have available to residents Newfoundland and Labrador is the Mind Well You 30-day challenge. So Mind Well You is a Canadian health tech firm based out of British Columbia. They offer mindfulness training online, which includes webinars and a 30-day mindfulness challenge. The webinar library contains a variety of mindfulness education topics, so you can learn more about what mindfulness is in a number of different contexts, and it is available in both French and English. The challenge is unique because it teaches mindfulness in action, so busy people can become more present and engaged with whatever it is they're doing. It only takes 5 to 10 minutes a day. Since May 2018, we've had over 4,000 unique users enrolled in the challenge. Newfoundland and Labrador is the first province in Canada to launch a 30-day challenge province-wide. And users have reported a 99% increase in their ability to manage conflict, 98% increase in their mental health, and 91% report that increase in their physical health as well. It is available through Bridge the Gap, where you can sign up for free. Like I said, there's no cost or referral needed for this program either. You'll get a text and email reminders to complete the challenge, and you can even invite a buddy. One of the cool features are that 98% of users actually have said that they would recommend this app to a friend. So it is heavily utilized and people are enjoying it as well. So I'll just show you the mindfulness web face. When you go into the Mind Well You, you have the option for signing up for a challenge, which is here. They also have live webinars as well as mindfulness drop-in classes that you can attend here. And then there's the full video library, which have pre-recorded webinars on various topics for both employers and individuals if you wanted to learn more about the mindfulness in different contexts. So this picture here is one of the main skills that are taught in the challenge, and it's called Take 5. It's a central tool in the mindfulness challenge, and it's a deep breathing exercise that can be used anywhere at any time. This actual tool can be downloaded, printed off. You can post it in your kitchen on your fridge or in your office on your board, just as a reminder to complete it, and you'll get the text message and email reminders as well to do the challenge. So the next program is Therapy Assistance Online, or for short, I'm going to call it TAO. TAO is an online internet cognitive behavioral therapy platform with 9 different programs tailored for people aged 16 and older. Cognitive behavioral therapy is an approach used to treat mental health and addiction issues such as anxiety and depression. TAO is currently available to over 1 million individuals through 52 universities in the US and 5 in Canada, including one. Newfoundland and Labrador was the first province in Canada to launch TAO provincially. It is free for anybody in our province through Bridge the Gap under the online program section. Research conducted in a large university counseling center shows that people who use TAO compared to treatment as usual had greater reductions in anxiety and greater improvement in global mental health, life functioning, and their sense of well-being. So it is proven to be a highly effective program. We actually have 2 ways to participate in TAO. So there's a TAO self-help online library, which has interactive education models and practice tools to help people understand and manage how they think, feel, and act. The modules can be chosen based on what people feel they need to be well and to live the life that they choose. TAO is also a platform that pairs this online education material with brief contact with a clinician. So for 4 to 6 weeks, the person will listen and read online material, approximately about an hour a week. And then that person will also speak with the counselor either by phone, video conference call, or in person. They can choose which option works best for them. These contacts are usually 20 minutes a week and provide an opportunity to talk about the person's learning from the TAO modules and to ask questions. However, the check-ins can be longer than that. It's really based off of what that individual needs from the counselor. For the completing TAO with a clinician, a referral does need to be made to your mental health and addiction services. And the other thing that we're seeing happen is counselors in our province are using TAO as an adjunct to their regular treatment. For example, you may go see one of our clinicians for depression management, and then they may prescribe a TAO module for homework, which can help you get better faster doing that work in between your sessions. So I'll just show you the TAO platform so you can see what it looks like. When you go on to it, this is our Newfoundland Labrador self-help platform. We do have the crisis lines all listed here if anyone needs to reach out if they're in crisis. And then you have access to all of the 9 pathways, which range for treatment for anxiety, depression, substance use issues, relationship and communication, pain management, as well as just a general well-being program that you can go in to complete. And when you go into any one of these programs or pathways, they have different modules that are available, and within each module they have self-reflection questions, videos, and examples that you can actually watch and skills that you can practice. One of the great features about TAO is they also have a full mindfulness library. So if you go to My TAO Tools, there's a mindfulness library option there, and there's over 20 videos that you can watch that range from anywhere from, I think, 3 to 10 minutes. So some people will sign up and they'll complete different pathways that are down here and available to them. And then other people might just sign up to be able to use the mindfulness library. So you can use the self-help version of this platform whatever way best meets your needs. And if you decide while you're using the platform that you'd like to connect with a clinician, like I said, you can just reach out to your mental health and addiction services and they will connect you with a clinician in your area. So the next service I'm going to talk about is through Strongest Families Institute. Excuse me. The Strongest Families Institute is a not-for-profit corporation providing evidence-based services for children, youth, and families. Telephone and online options are for youth aged 3 to 17 and their families who are experiencing behavioral or mental health problems. Strongest Families began as a research project at the IWK Health Centre in Halifax, Nova Scotia. The programs offered today are the result of a 6-year research period to develop effective programming for children and families. The Strongest Families 12 to 17-week programs are individualized and based on cognitive behavioral therapy. Families receive skill-based information by either a paper handbook or access to an online account and have around 30 minutes of weekly telephone coaching from a Strongest Families coach. This service is also available in English and French. So there are a number of programs offered by Strongest Families in our province. The Parents Empowering Kids is for behavioral difficulties for children between the ages of 13 and 12 years old. This program has helped parents learn to deal with common childhood behavioral problems, such as temper outbursts, not listening, verbal and physical aggression, and difficulties paying attention, just to name a few. Then we have the anxiety programs, which is actually broken down into two programs. Chase Worries Away, which is for individuals between the ages of 6 and 11 years of old, and then Defeat Anxiety, which is for those between the ages of 12 and 17 years old. These programs educate parents and children or youth about anxiety, teach them relaxation skills, and how to face worries in real life. The children's program typically deals with difficulties separating from a loved one, worries about performance, and specific fears. And then the youth program typically deals with worry about performance, social anxiety, and specific fears. The Defeat Anxiety program, which is for those between 12 and 17, comes with a group-based option for parents as well. And then the last program is the Dry Nights Ahead bedwetting program. And this is to help with bedwetting for children between the ages of 5 to 12 years old. And it has available in it a urine alarm and a daily tracker. And this program is group-based as well for parents. So referrals for any of these Strongest Families programs can be made by any professional working with the family. So it could be a health professional, a doctor, nurse practitioner, guidance counselors at school, mental health and addictions worker, child protection worker as well. Once referrals are made on the family's behalf, the family is contacted within 24 to 48 business hours from Strongest Families. So some of the benefits of Strongest Families include that it strengthens coping skills in families. It's been clinically proven to improve parental mood and stress. And it increases accessibility as the exercises can be completed on someone's own schedule, and coaching sessions can actually take place during the evening time as well. The results have been overwhelmingly positive in our province. To date, we've had about 1,000 families here complete the program with over a 90% success score. So the next program that Strongest Families offers is the ICANN program. And ICANN supports young adults aged 18 to 30 in learning life skills to overcome anxiety and cope with major life stressors. The program can be completed within 3 to 4 months. The program offers weekly distant telephone and online coaching similar to the other 3 programs I just described, and is free to anybody in Newfoundland and Labrador. This program, however, doesn't require a referral by a person working with the family. The individual can actually refer on their own. They can call Strongest Families directly by calling 1-866-470-7111 and requesting the ICANN service, or they can visit Bridge the Gap and complete an online self-referral to the program. And if they wanted to, they could also connect with the mental health and addiction services in their areas to have that referral completed on their behalf as well. On the Strongest Families website, they do have a couple great videos, but for the interest in time, I won't be able to play them. But if you wanted to learn a little bit more or hear a little bit more from families who've gone through the program, they do have a couple YouTube videos that are here. And the Bell Strongest Families video is a really good one if you want to hear from families who've actually gone through the program and have had some really great outcomes. So now I'm going to start talking about some of the helplines that we have available in the province. And 811 is the first one that I'm going to go over, which is our Provincial Helpline. So dial 811 anytime from anywhere in our province. And if people use the voice over internet protocol or web-enabled telephone services like Skype or Google Talk, 811 might not be able to connect, so that's important to know. Instead, you should call 1-888-709-2929 to reach the Helpline, or TTY, which is 1-888-709-3555. The 811 Helpline is staffed by experienced registered nurses who can help provide information about health services in a person's area and answer questions that they might have about health-related topics. Staff can help a person decide what steps to take to manage their physical and mental health and the health of their family as well. If a caller is provided with mental health service information, he or she will be called again or have a follow-up call to see if the information was helpful and to offer any additional assistance if it's requested. Other services at 811 include the Recovery Aftercare Program, Poison Control, as well as Dial a Dietitian. And the Dial a Dietitian service is designed to encourage people to make healthier, more informed food choices and to receive tips on healthy eating and nutrition. To access that service, people can call the Helpline Monday to Friday from 9 a.m. to 12 p.m. and 1 p.m. to 4 p.m. Or you can call 24/7 and request a call back at a time that's more convenient for you. You also can email a dietitian through the Helpline website, which is www.yourhealthline.ca/dietitian. The Helpline received over 40,000 inbound calls in 2018 to 2019, and they made over 2,500 outbound calls during that time period as well. So it is heavily utilized in our province. So next we have the Provincial Mental Health and Addiction System Navigator, and that's a position dedicated as a central point of contact for individuals and families throughout the province. As you can see, we have a lot of e-mental health services, and we have even more in-person services and specialized services across the province. And so Barry Hewitt is the Provincial Mental Health and Addictions Navigator right now, and he helps individuals navigate all of those services that are available. Barry can be contacted Monday to Friday, 8:30 to 4:30 by calling 752-3916 or 1-877-999-7589, or you can email him at barry.hewitt@easternhealth.ca. Next, we have the Mental Health Crisis Line. The Provincial Mental Health Crisis Line offers free, confidential telephone support 24/7 for individuals who are experiencing a mental health crisis. The Mental Health Crisis Line is staffed by clinicians with Eastern Health and provides individuals with crisis intervention and referrals to local services. It can also be used to request a mobile crisis response team where it's available in the province. The Crisis Line is also available to help health professionals on a consultation basis by phone. And the Crisis Line received over, I think, 18,000 phone calls roughly last year. So again, heavily utilized. The next phone line we have is the Channel Warm Line. And the Warm Line offers non-emergency, non-crisis telephone support for people in our province living with mental health and addictions issues, as well as their loved ones who may have mental health and addictions issues. The channel offers support to anyone needing a non-judgmental listener. They have trained peer support workers who have firsthand knowledge of recovery and mental health and addictions experiences. Their motto is, "We understand because we've been there." The Warm Line is organized by Channel, which is the Consumers Health Awareness Network of Newfoundland and Labrador, and is available 7 days a week from 10 a.m. to 12 a.m. The Warm Line is also heavily utilized in our province, with over 2,000 calls in August 2019 alone. So the next one we have is the Gambling Helpline. For some, gambling turns into a harmless distraction to a serious problem that can disrupt their lives and the people around them as well. It is estimated that 3.2% of Canadian adults are affected by problem gambling, which could be almost like 16,000 individuals in our province alone. The Gambling Helpline is available to anybody 24/7 experiencing a problem with gambling or has their life impacted by gambling, which could be your life impacted by a friend's or loved one's gambling behaviors. The helpline provides information, resources, as well as crisis intervention. Another service we have is the Kids Help Phone, which is free, 24/7, and anonymous, as well as available in French and English. There are several options where children and youth can connect. So they can connect by phone or the live chat. And there's also the Always There app as well. Kids Help Phone offers professional counseling, information, and referrals. And it's important to note that they will actually serve anybody who self-identifies as a child or youth or is dealing with a child or youth issue. For almost 30 years, the Kids Help Phone has been there for young people throughout Canada. In 2018, it provided 187 counseling sessions and 117 texting conversations per day. Over 850 young people contacted Kids Help Phone every day for a combination of information, counseling, or referrals. Of those who used the service, 98% said they would reach out to Kids Help Phone again, and 85% had said that they felt an immediate reduction in stress after they reached out. Newfoundland and Labrador has the highest use of Kids Help Phone per capita. 2.5% of all national contacts come from our province, while only 1.2% of the Canadian youth population actually live here. Another service that they have is the crisis text line powered by Kids Help Phone. But this service is actually available to anyone in our country, regardless of age. You could be 4 or 94. You do not have to self-identify as a child or youth. In order to use this service, you can text TALK to 686868, connect to a volunteer crisis responder who will help with any issue, big or small. All of the crisis responders are trained volunteers donating their time to help people in crisis. They are trained to bring texters from a hot moment to a cool calm through active listening and collaborative problem solving. The service is free, it's confidential, and it's available 24/7. I should note that this service is not anonymous, it is confidential. However, they do have access to the phone number that is being texted. So if somebody is identifying as not being safe, they can make a report to the local appropriate people to ensure that that person is safe and not going to harm themselves. Next, we have the Smokers Helpline. And Smokers Helpline programs offer follow-up support to help individuals through the process of reducing their smoking or quitting. So they have over-the-phone services where the individual chooses, they can speak to a helpline quit coach, and that person can call the individual back every 1 to 2 weeks, and they get up to 12 phone calls. There's email, where the individual can receive 1 email per week for 5 weeks to help with developing a quit plan and moving forward in their smoking cessation. And individuals are encouraged to respond to the emails for additional support if needed. They also have text options where the individual can receive a text per day for up to 12 weeks with short quick tips to help build their motivation and their confidence in their quitting plan. And these individuals can also text back to the helpline at any point for additional information and support as well. And then they have the online option. So through the helpline's website, www.smokershelp.net, individuals can access a variety of online programs that provide individualized, tailored support to help them reduce and quit. They have interactive tools such as a savings calculator and standardized quizzes, helpful articles filled with practical tips to help individuals build their own personalized quit plan. They have a web app called kickash.ca, which contains lots of fun features to help individuals stay motivated and see their progress in quitting. They have an online chat where people can connect one-on-one with a quit coach and ask questions and get additional encouragement and support. And then they also have the online group program, which is a 4-week online program that provides 4 weekly counseling or 4 weekly online group sessions, which offer valuable support from smoking cessation facilitator, along with peer support from other people who are also working towards quitting as well. So as I mentioned, the live support from a quit coach is available Monday to Thursday from 9 a.m. to 9 p.m. and then Friday from 9 to 5. There is no age restriction, and more than 1,000 individuals have enrolled in the cessation program each year in our province. There's over 4,000 over-the-phone sessions and about 1,500 email sessions every year. And individuals are invited to contact the NL Smokers Helpline for information about vaping products as well. So vaping prevention as well as vaping cessation, because we are seeing more of that happen in our province too. So if I just show you the website for Smokers Helpline, you can see that they have all the contact information and the different ways that you can connect and how they can help. They advertise their online group program that's available, their Kickash they have, and then also different featured articles that you can use, and then the quick tips and tools that are down here as well. So it's a great website if you're looking to cut back on smoking or quit smoking altogether. Next, we have the First Nations and Inuit Hope for Wellness Helpline. And the Hope for Wellness Helpline offers immediate mental health counseling and crisis intervention to all Indigenous people across Canada. It's a national phone line and it's available 24/7. You can call the toll-free number at 1-855-242-3310 or visit their website at www.hopeforwellness.ca and use the online chat bot to connect with a counselor online. You can connect with an experienced and culturally competent counselor, and if the person wants to, they can connect just to talk if they're distressed, if they're having strong emotional reactions, or if they're triggered by painful memories. You are able to connect to a culturally appropriate counselor. If asked, the counselor can also work with the person to find other wellness supports that are available to them in their local areas. And phone and chat counseling is available in both French and English. And on request, the phone counseling can be available in Cree, Ojibwe, and Inuktitut as well. Lastly, we're looking at telehealth. So telehealth provides healthcare closer to home by using video conferencing to connect a person with a healthcare provider in a different healthcare facility. These appointments are arranged through a healthcare provider to ensure that a room, equipment, and times are available. Newfoundland and Labrador was the first province to use video conferencing over 30 years ago and is under the leadership of Newfoundland and Labrador Centre for Health Information. In 2017 to 2018, over 20,000 patient appointments took place via telehealth in our province. There are currently innovative projects piloting the use of telehealth for some allied health services as well, such as CMS and mental health psychoeducational groups directly in client homes. It is exciting to see that the continued accessibility improvements for residents in this province grows and grows every day. A telehealth appointment is very similar to face-to-face appointment. A person can see, hear, and talk to his or her provider either from their home or from the community clinic that they're attending. Telehealth reduces the need for travel and increases access to previously unavailable services like allied health professionals or specialists. Right now, we currently have over 104 telehealth sites across 64 communities in Newfoundland and Labrador. So that's it for our e-mental health services in our province. I hope that this introduction and overview will encourage you to use e-mental health services and to spread the word to your coworkers, families, and friends. Thank you for attending the session, and for more information on any of these programs, you can visit bridgethegap.ca or call 811 or reach out to one of the e-mental health managers in your local regional health authority areas. Thank you and have a good day.